Good Sunday morning. And today on Perspectives, our family members, our friends, our neighbors, they're dying from opioid drug overdoses at numbers higher than any year before. Now, many become addicted to the opioid drugs after being introduced to prescription painkillers following surgical procedures, even dental work. Officials now consider it an epidemic, as this crisis is causing pain and suffering for individuals and families, of course. Now, they also say it's causing a huge financial burden to our communities here and across the country. The numbers, they're staggering. Experts say that more than 2 million Americans will suffer from opioid addictions this year. Now, since 1999, more than 700,000 Americans have died from a drug overdose. 130 Americans on average are now dying every day from an opioid overdose. Of course, this is horrific information, and again, we could be talking about our family members, our friends, and our neighbors among the stats in those numbers. In Seminole County, Florida, law enforcement is on the front line as it deals with the very public results of opioid drug use. Recently, the Sheriff's Department had to respond to a call where 3 occupants in a vehicle were in need of immediate attention, and due to the condition that they were in because of drug use. Let's take a look.
911, what do you need, please? Fire and medical.
So I have 3 people that are, apparently they seem to be passed out drunk, not waking up in my parking lot. Like 2 of them are on the ground.
11:30 on a Saturday night. Deputies are called to help 2 men and a woman, all unresponsive.
When I pulled into the gas station, it's very well lit. You could tell right away that there was something different about this one.
Yo, bro, wake up.
You're smacking at them, you're screaming, you're shaking stuff around, moving things, and they're not doing anything.
In the back of your mind, you're like, well, what is this? What else is going on?
At this gas station on Red Bug Lake Road,
Hey!
the normal measures deputies take to wake people up aren't working.
Now at this time, we're realizing we have probably an overdose, a triple overdose at that.
And I've never responded to one where there's 3 people and they're laid out, completely unresponsive, turning blue, the colors leaving their faces. It's scary.
And now the deputies have custody of this pickup. They have to determine what caused all this. Finally, Henry discovers this small baggie. She later asked the female who overdosed what it was.
Then I said, can you be candid with me? What did you think you were taking? And her reply was, oh, I thought I was doing cocaine. And she's like, but that's not cocaine.
In reality, the drugs the trio were taking here that night were laced with fentanyl, a synthetic opioid that drug dealers use to make their drug supply last longer and more profitable. But it also makes the drugs far more deadly.
Sometimes the drug users, don't even know that their drugs have been mixed with this. And this is leading to fatal overdoses at record numbers.
Now, a very scary situation for the 3 people who had overdosed and for the deputies, of course, of Seminole County. Now, what exactly is causing this opioid epidemic of addiction and overdosing? What do we do about it as a community or as someone whose family member, friend, or neighbor is being affected? Virginia Guy, Executive Director of the Drug Education Council, and Baldwin County Sheriff Huey Hoss Mack are here this morning to give their perspective about this drug abuse epidemic. Also today, Pastor Chris Patrick of Wings of Life, a place where the addicted can find help, takes us to the break.
People, they can still buy opiates on the street, and so it's harder now to doctor shop. And of course, some of these drugs that they get, not only opiates but other drugs, they're not like FDA approved, so they don't know what they're getting. So a lot of people have died from overdoses. They're used to, taking this much, and then they take the same amount and they die. And because this drug had a little something different in it than that drug did.
And of course, we've shared with you some of those horrific numbers and stats about the opioid drug abuse epidemic. And here to help us fully understand what's happening and what we can do, Virginia Guy, Executive Director of the Drug Education Council, and Baldwin County Sheriff Huey Hoss Mack. We thank you both for joining us this morning.
Good morning.
Virginia, give us an overview of where we are here in South Alabama as it relates to some of these horrific numbers that we're hearing.
Right. In our community here in South Alabama, it's probably not as bad as in some of the areas we hear about, like Oklahoma, West Virginia, some of those places. But we do know that it's far more prevalent than the average person understands. And we have, we do have people overdosing in our community, and we've got families suffering from this. We've got law enforcement at risk. We've got, you know, it's overburdening our medical community. It's a huge problem.
Can you break it down into layman's term exactly what it is for those who aren't familiar with drugs and some of the older people wanting opioid who may not have ever had to deal with the pain issue? What exactly is it and what's happening?
Right. The drugs themselves are the drugs that are like the morphine, heroin, those kind of things. And then there's also the drugs made from that are FDA approved, like the, you know, oxycodone, Norco, you know, a lot of those that are sold under those. They're primarily, you know, needed for pain. And when used appropriately, they can really be a godsend for treating acute pain right after surgery, right after an accident. It's more the long-term use is where it becomes problematic. You know, now when we talk about this, we probably need to take end-of-life care or cancer pain off the table. We're talking about, you know, people who are, you know, living and functioning and working, you know, that these can become a problem, and particularly children. I'm real concerned about this use in children.
Now, is this prescribed for the children or something that they're getting their hands on?
Well, both are a problem. You know, I really encourage all parents, if your child is you know, suffers say an injury from a sports event, to talk to the medical professionals about are there any opiate alternatives for pain. If they do need an opiate, what do they need, the lowest dose over the shortest amount of time. But for the family to be really proactive in talking with medical professionals about this with their children, and particularly with dental care. You know, I know the dental associations have recently sent out, you know, kind of alerts encouraging their physicians not to prescribe opiates to teenagers if they say have wisdom teeth extraction or something like that. We know the developing brain is much more vulnerable to developing addiction than a brain that's fully formed, which takes to about age 25.
That's right. Sheriff Mack, you saw the piece on Seminole County, Florida. Have you had any situations similar or just like that here in the Baldwin County area?
Yes, we have. We've encountered individuals that have been unconscious upon our arrival. We have individuals that sometimes we arrest. They come into our facility. They're going to be under the influence of a heroin or some other type of opiate, and we have to detox them, which becomes a huge issue in dealing with them. And about a year and a half ago, we actually had 2 deputies that were exposed, had a fentanyl exposure during a search of a car in which there was some illegal drugs in the car. Both of the deputies got exposed and had to be treated with Narcan.
And when you say exposed, exactly what do you mean when you say exposed to this? One
of the unique things about fentanyl and parafentanyl, which is another drug, these drugs are very aromatic. A lot of times when you're handling some of the drug packages, they will give off just enough in the air, and then you breathe this in, and it automatically, and it causes acute respiratory distress. It can lead to the person stops breathing, they lose consciousness, and it's typically found they'll start tingling in the hands, they'll feel this happening. Both of these deputies actually were searching a car, found some illegal drugs, and about the time they went to handle the drugs, the suspect said, "I wouldn't touch that if I were you." And it was already too late. One of the deputies immediately started having tingling in his hands. They both had to undergo the nasal spray, Narcan, which we issue to some of our officers, and our med units in Baldwin County carry those as well. But ultimately, they actually had to go to the emergency room and have an additional dosage of the Narcan to counteract the fentanyl effects on each of them.
My goodness. Briefly tell me, do you feel comfortable with the training that law enforcement has been receiving to deal with this here locally?
Yes, it's got to continue though, because the drugs change. This is a new dynamic for most law enforcement. You know, years ago you were worried about in the cocaine era and the meth era and everything, you just didn't, if you ingested it or you actually got a large amount of it, it was one thing. But with the fentanyl and parafentanyl being 1,000 times more potent than actual heroin, so just it's literally the size of a pinhead can cause you to go into respiratory arrest in the right exposure. And so it is a safety issue, it's a public safety issue, and it's a safety issue for law enforcement, EMS personnel, anybody that may come in contact with this.
We're going to talk more about this, as well as also here this morning to give us some more information to combat the problem as well as how to deal with it is Dr. Karen Marlowe. She's a professor of pharmacy at Auburn University, and she joins our discussion right after the break this morning. Meantime, Pastor Chris Patrick again of Wings of Life takes us to the break, telling us that he's seeing more deadly overdoses than ever before.
We got new drugs coming out all the time too that are just they put all kinds of strychnine in it. You know, you don't know what's in it, rat poison, whatever. And so people are dying. Really, I've seen more people die in the last 5 years than I've ever seen from overdose, including heroin.
Welcome back to Perspectives, and joining us now, Dr. Karen Marlowe, as mentioned, professor of pharmacy, Auburn University, the Mobile campus. And we'll, of course, welcome you to Perspectives this morning. Thank you. Virginia brought something with her that we're going to talk about. Virginia, this is one of the things that a family member can have, I guess, available in the event they have concerns, as well as something that's being used by the professionals as well.
Right. This is an overdose reversal. It's called naloxone, commonly referred to as Narcan. It comes in different varieties, but this is the nasal spray that when we work with families, if they have somebody, one of their loved ones who has an opiate addiction, you know, we recommend they keep this on hand. It won't definitely reverse it, but it is just one more tool that they can have to try to live another day.
Yeah, it makes a difference. You have some stories that you've shared with me of folks that we all probably know who've lost loved ones here in our local area. Dr. Marlowe, what kind of dialogue is going on in the medical community now about this epidemic? Because we've had physicians, we could say, charged with being accessories to the problem. What kind of dialogue is going on right now?
I think the biggest part to recognize on any dialogue with this is it's so multifactorial. There's a community piece, as y'all have been discussing. There's a responsibility for healthcare providers, for first responders, and many of the efforts I've been involved with are trying to bring all those pieces to the table and talk about how we can all contribute to solutions. So how can we educate healthcare providers about changing our prescribing practices? Virginia mentioned some of that's going on. How can we educate people in the community and healthcare providers about naloxone? How can we change education efforts in the schools so that we can make our children and our parents advocates in their own health care and about their own usage of medications and storage of medications. That's an effort I've been involved with, keeping medications only the amount of time we need them, and when we're done, if we have medications that aren't being used, to get them out of the home. Those pieces, all those different pieces, we have to address each piece. And the other piece is treatment after opioid use disorder is recognized. And that's another important piece. Getting our insurers to recognize, to pay for naloxone, to get them to pay for treatment for recovery. So all these efforts are being addressed. The governor has a task force that's working on a multi-pronged effort and has brought many different people to the table to work on this, healthcare providers included. And we're working on it at all these different levels. And I think we're making progress. You have to work on each piece because there is no one simple solution.
Talk about the treatment area briefly, if you would, of what the protocol now is compared to as we sit back and evaluate what's going on and where we are now? There have been some change in protocol.
Treatment for recovery?
Yes.
So there are some new options that are available. Our biggest challenge is getting those resources out into all the areas of our state. So we actually have more options available here in Mobile and Baldwin County. Now we're trying to make sure that those options are available in all the different areas of our state and to all the people in our community, so that those who have different levels of insurance, all of people have access. And there are a limited number of, so to speak, beds for those opportunities. And so we want to make sure that people have the right opportunity that fits their needs.
Do you see, I hate to cut you off
you're
there,
fine.
do you see a different perspective also of how doctors are prescribing the medications now?
Sure. There's been a gradual decrease in the number of prescriptions over the last few years, and Alabama was a leader in prescriptions, and we're gradually decreasing that number, and that's been a part of that education effort, an important part of that education effort. But we have to continue, because although the prescriptions are decreasing, our overdose numbers aren't reflecting that increase as much as we'd like. And so we need to, those overdose numbers reflect prescription overdoses and overdoses on drugs like you saw in that video with fentanyl, which can be both a prescription agent and a street drug. And so we have to continue to educate on both of those fronts.
And when you see that, Sheriff Mack, what type are you seeing most of in the field?
Well, most people that if they become addicted to an opioid, typically, and they started out taking a pill for a pain management or pain medication, and they can no longer get that, then they revert to heroin. So that's why we have seen a dramatic increase in the usage of heroin, particularly in Baldwin County. Heroin has now surpassed cocaine in what we see and in what we're getting out from out in the community. So that's a huge issue, and then you factor in that a lot of the heroin that we're getting now may be laced with the fentanyl or the parafentanyl to heighten the effect. So it's, we say it's kind of like mixing dynamite with gasoline. Is the combination that you're seeing, and we are seeing that in our communities.
When we come back, we're going to talk more about some of the other solutions that you're offering, as well as how to contact the different groups who are available to help with this crisis. Now, here's some good news. Addicts can be helped even after years of drug abuse. Minister Richard Jones of Wings of Life survived 30 years of using. He's now drug-free and helping others. He takes us to the break.
Well, I can relate because I overdosed numerous times when I was using drugs, and only to use them again when I came through the overdose.
Welcome back to Perspectives, and again our guest, Dr. Karen Marlowe, Virginia Guy, and get ready to call you Sergeant, but you're a General, our Sheriff, Huey Hoss Mack. We thank you all, of course, for being here today. One of the areas that you mentioned earlier about putting all the pieces together and working with the different agencies, as well as opportunities to hopefully be a solution to the problem. The DEA, how does that work into play here?
Sure. So traditionally there have been two big take-back days, one in the spring and one in the fall, and those will continue to go on. But what we found is it's important to not just wait for those days. And so the DEA has a website that community members can punch in their zip code and locate places within their community that they can dispose of not just controlled substances or opioids, but also other prescription medications. Get those out of the home. And so if they're done with their prescriptions, it's really important to get those, not save them for a rainy day, get those out of the home so that other people in their home don't have access to them. And then they're not around, somebody can't overdose on them, young children, other members of their family.
Very important. That makes a lot of sense. And of course, we have the website available for you. You can go to our website as well for more information how to reach that DEA website. Virginia, how are you offering your services to the community to be available to educate?
Right. Well, we're available to anybody in the community. They can visit our office, call us on the phone. We'll be glad to help and talk with them about their family situation. We do know that the key to this is prevention. We know that that will not only save a lot of heartache, it'll save a lot of dollars, you know, in our community. So we want parents and educators to talk to their children early about the dangers of this. We know 90% of addiction begins in the teen years, and so we think it's very, very important to educate and for families to talk about it, schools to talk about it, faith groups to talk about it, and you know, get that out in the community.
And Sheriff Mack, we have a number for the Sheriff's Department as well for services that you offer to the community.
Well, I think one of the things, Eric, for everybody to understand, it's difficult a lot of times for a family member or a close friend to quote unquote turn somebody in that may have an addiction to drugs. But one of the things we do is if we get a tip from a family member or someone that is calling to say, hey, this individual's, we don't come in guns a-blazing with a search warrant and arrest them. We're going to look towards their personal safety first. And so they can call us, they can call any local law enforcement. We'll work with them to see about perhaps referring them to such entities as a Drug Education Council. It may be a medical referral to a doctor or to an emergency room. Right. But we'll work with them, and we also continue on. Yes.
Right. We thank you for sharing that. And of course, we have a contact information again for Dr. Karen Marlowe as well through the Auburn School of Pharmacy, the Mobile campus, where you've got information available, and you can also be another resource to help those in the community. We thank you all so much for joining us here on Perspectives, and of course you as well joining us here on this Sunday morning. We'll be here again next Sunday morning at 7:30 for another Perspectives as we discuss important issues and seeking solutions. If you have any ideas or topics you'd like for us to address, drop it to us at perspectives@fox10tv.com. I'm Eric Reynolds. Have a great week.